Fresh vaccine news on the COVID-19 front today. The CDC now says people getting Pfizer or Moderna vaccines should consider waiting up to 8 weeks to get their second dose. Previously, the recommendation was just 3 weeks. Officials say change is in reaction to research that shows a longer interval can provide protection that lasts longer. So far, the longer period between the first 2 shots is only recommended for people ages 12 to 64. All right, and joining us now to help us get caught up on all the day's news regarding COVID, we got Dr. Jake Prunuske. I hope I said that right, doctor. I know it was a stretch, but thank you for bearing with me. He's a professor of family and community medicine at the Medical College of Wisconsin. It's a pleasure to have you back, Dr. P. We appreciate your time. So let's talk
Thank
about.
you so much.
It's our pleasure. Let's talk about this new information about spacing out our first 2 vaccine shots, right? Can we expect more changes like this, I guess, as these long-term vaccine trials continue?
I think it's an important question to ask. And as you know, we've all seen throughout this pandemic, the science is continually evolving. Early on, when we had the initial COVID virus and Delta, there was an immediate need to get vaccines into arms. As we get further out, we can step back and revisit some of those things like timing and what's going to get us the best immune response. We see this right now in the trials for children under age 5, where we're trying to decide the timing of their primary vaccine series and 2 versus 3 shots and what that spacing is. I think as the pandemic shifts to endemic, meaning this time when we're all just living with COVID, but it's not having such a severe impact on our day-to-day lives, in all likelihood, there'll be a need for differences in the timing of the vaccine and potentially for boosters at some frequency. But where that's going to land is still up for grabs.
All right, it just seems like the information is constantly changing as the virus evolves. But they say that's what science is all about. All right, doctor, there's also talk, since you spoke about going from pandemic to endemic, right? Let's talk
Mhm.
about the state of California doing just that. Talk about what exactly that means as we move forward.
Yeah, absolutely. There's actually a number of states that are starting to make this shift in response to the situation on the ground in each of those states. So right now, the pandemic is impacting different states differently based on the communities in those states, on vaccine prevalence, and on other factors versus how rural or how urban an area is. And I think increasingly there's a recognition that a single unified national public health response isn't always the right approach for an individual area. And what we're starting to look at is individual states and areas within those states and health-based and science-based decisions based on what the pandemic looks like there, not what the pandemic looks like in other parts of the world or other parts of the country. I think this is a really necessary and good step forward, and it's going to allow local public health authorities, state governments, school boards, and school officials, and others in those positions to make decisions that are going to best meet the needs of the members within their community.
So I got to ask you, because you mentioned the single approach that each state basically should make their own rules. But I mean, it's not like they're closing state lines. Folks are still traveling state to state, and some even internationally. So, I mean, could this do more harm than good?
We'll see how things evolve. For me personally, for example, if I'm going to travel, I can look at how many cases are in an area, what the transmission rates are like in that area, and then make a decision, for example, to mask or not mask. I think what we know is that if you're going to be in a tight, enclosed indoor space with lots of people and vaccine rates are high, that masking helps reduce transmission. But if I'm going to travel to an area where it's not dense, it's not crowded, and the transmission rates are low, it may be reasonable for me not to wear a mask in that setting. Regardless, all of us should still look at getting our primary vaccine series and our booster, practice good measures like washing our hands. But I think some of the measures we've taken from a public health standpoint can be adjusted based on uh, how common transmission is in a community and what the pandemic looks like. So how I approach my own health and safety might look different in one state compared to another state, depending on how the virus looks in those areas.
All right, Doc, what should we be focused on at this point? I mean, 2 years in this thing.
Yeah, I'm really hopeful right now. And as our Omicron peaks recede and the number of cases is going down almost everywhere across the country, and more people are choosing to get vaccinated and get boosted, I think this is a pivot point for us. I think we can look forward to hopefully continued relaxation, but then probably additional spikes, but hopefully less severe than we have in the future. I think for those who are still hesitant about getting the vaccine, having a conversation with their family doctor or other health professionals about getting that vaccine is important. And then I think thinking about who else is in our circles, right? Do we have little kids who are not yet eligible for the vaccine? Do we have family members or friends who can't get vaccinated because of immune suppression or and making sure that we're respectful not only of our own health and safety, but the health and safety of others in our circles and in our communities.
Yeah, last question for you. I mean, this is a global pandemic, right? So, I mean, everything may be all good here in our country, but I mean, what about countries that have low vaccination rates and the situation we had prior with Omicron? I mean, what about the next Omicron that could be far worse?
It's certainly a concern. The good news is so far our vaccines seem to be fairly effective at protecting against the variants, which is welcome news. I know the vaccine manufacturers have learned a lot in this process and potentially will have additional boosters to address additional variants. You're absolutely right, though, in that this is a global challenge we all face, and it will require global solutions. My hope is that as we go further into this, that we continue to see expansion of vaccination worldwide, and we continue to take public health measures that help reduce our risk here in the States.
All right, Doc, we appreciate your expertise and more importantly, your time. Thanks for stopping by to chat with us. All right, and now, BNC Live. We're following a story that you might not hear a lot about, but we're out there.